Hi, I am Pramlintide Acetate. Then my brand name is Amylin. My drug classification is I am a antihyperglycemic. My pharmacologic classification is I am a human amylin analog. My pregnancy category is category C. My pharmacokinetics is that I am administered immediately before eating. Also, I am absorbed rapidly by the body through subcutaneous. I do not extensively bind to red blood cells or in albumin. Also, 40% of me is unbound in plasma. I am metabolized primarily by the kidneys, then I am excreted in the form of urine. My half-life is approximately 48 minutes. My mechanism of action is that I am an analog of human amylin. So, amylin is colocated with insulin in secretory granules and cosecreted with insulin by pancreatic beta cells in response to food intake. So, amylin and insulin show similar fasting and postprandial patterns. So, these three mechanisms have been identified that may contribute to a hypoglycemic effects. So, it is a central mechanism involving appetite suppression, slowing of GI emptying, and by inhibiting the release of glucagon by alpha cells in the pancreas. So, the reduction in glucagon reduces the breakdown of glycogen to glucose by the liver. So, as a result of these three mechanisms, both endogenous, so endogenous is a liver-derived, and exogenous, meal-derived, increases in plasma glucose. So, it is regulated. So, allowing exogenous insulin therapy to be more easily matched to our needs. So, if insulin is absent, so hypoglycemia effects is does not occur. Then, when combined with insulin, so it can affect, so like a hypoglycemic effect.
Hi, I'm Pramlintide Acetate and I am indicated for patients with type 1 and type 2 diabetes mellitus as an adjunct to preprandial insulin therapy in patients without adequate glycemic control of insulin therapy. And I am contraindicated to patients with hypersensitivity to pramlintide, diagnosed to gastroparesis, and hypoglycemia unawareness. My side and adverse effects is that patients with type 1 diabetes mellitus will experience gastrointestinal disorders such as nausea, vomiting, and anorexia, while CNS disorders such as dizziness and fatigue. The patient can also experience arthralgia and allergic reaction. And for patients with type 2 diabetes mellitus, will experience gastrointestinal disorders such as nausea, anorexia, vomiting, and abdominal pain. CNS disorders such as headache, fatigue, and dizziness. Respiratory disorder also will occur such as cough and pharyngitis.
Nursing responsibilities in administering pramlintide acetate. So before administering the drug, assess for contraindications and cautions before administering the drug, such as the history of the allergy to the drugs, pregnancy and lactation status in women, and severe renal and hepatic dysfunction, which are contraindicated in using of the drug. Perform a physical assessment to establish baseline data before administering the drug therapy, and to evaluate effectiveness and potential adverse effects during therapy. Check for the serum glucose concentration before administration, before and after meals, and at bedtime. Assess orientation and reflexes, baseline pulse and blood pressure, adventitious breath sounds, abdominal sounds, and function to monitor effects of altered glucose levels. Assess for the nutritional intake, Noting any problems with intake and adherence to prescribed diet, it is to help prevent the adverse effects to the therapy. And monitor the results of laboratory tests including urinalysis for evidence for glycosuria and renal and liver function tests in order to determine the need of dose adjustment and to evaluate for signs of toxicity. In administering the drug, administer the drug as prescribed in the appropriate relationship to meals to ensure the effectiveness of the drug. Educate the patient about the drug that is administered and the warning signs to report and the family as well. After administering the drug, monitor patient response to the drug therapy. Monitor for adverse effects like hypoglycemia and gastrointestinal distress. Assess for hypoglycemia and also take note diaphoresis, tremors, dizziness, anxiety, headache, tachycardia, numbness in mouth, hunger, diplopia, and difficulty of concentrating. Be alert to conditions that alter glucose requirements like fever, the increase of activity, stress, surgical procedures. Provide comfort measures to help patient cope with the drug therapy. And also evaluate patient understanding on the drug therapy by asking the name of the drug, its indication, and adverse effects to watch for.